refunneling of the money, but it would not necessarily cost the average worker more or the average person more?
Actually, the numbers that we look at, it would cost the average person less.
Because, when I interview people and to talk about this, one of the concerns that I hear so often is, well, if we're going to be taking care of all those additional people, it might be a nice thing to do, but how are we going to be able to afford it, because they'll take more out of our paychecks, or it'll cost us more in order to do that?
Well, so here's what we're talking about. We're talking about collecting the dollars, not out of your paycheck. So the amount of money that the employer may be pulling out of your paycheck right now for your health and premium, you would receive those dollars back. Instead, these would be dollars that would come out of the taxes. And for the overwhelming majority of Americans, anyone who made less than, say, $250,000 a year, they would see an increase overall, and yet they would have guaranteed access to health care and freedom of choice of provider and location to receive that health care.
So I have a quick question here, kind of a fundamental question that really gets me every time that I have to look at the delivery of our child last year and the costs associated with things. Isn't there some, and I realize the overhead costs are built into a lot of these things, but isn't there a fundamental problem when you go in and you get your bill and you see 2 Tylenol for $90? I mean, isn't that a fundamental problem in all of this?
Absolutely, and that's part of those are part of the dollars that we capture, because you no longer have to count every Tylenol pill, how it's dispensed, and charge for the person who puts it in the little paper cup that goes up to the nurse who puts it on the tray, who brings it to the patient who takes it. We count differently, and in a single-payer healthcare system, hospitals are paid under a global budget. So it cost you X number of dollars to operate last year. So this year, the inflation rate is Y. So for your operations, you'll get X times Y, or X plus Y, to operate. Now, figure out how to do that most efficiently. And so instead of counting every syringe that you use, instead of counting how many Tylenol you dispense, you can begin to look at things in a more global perspective and say, what's it going to take to render care to this population? And by the way, what are the things that we can do to improve the health of the community that surrounds us?
Dr. Fagan, sorry to interrupt. Isn't that one of the things that Kaiser has kind of done, not to mention names here, but don't they kind of have this model of in for 15 minutes, you have your schedule set and you see your patients, and regardless of how much care they need or how much, TLC they might need, they go in and they're on a schedule and they're on a clock, and these efficiencies make people that I know go to Kaiser feel really kind of slighted that they have to go there.
Yeah, but you're talking about a different thing. See, we're talking about freeing them up in terms of this for funding, and you're talking about what Kaiser does in terms of operations for delivery of care. Let me give you another model that might. I have a friend who was a cattle farmer who was elected to the head of the health planning board for a small town, Prince Albert in Saskatchewan, Canada. And they had the notion, okay, this is how many dollars we have to provide care for our community. And with that, they said we have 2 hospitals in this small town, and neither is full. And yet we have a terrible problem with low birth weight infants, and that's because women who lived out in the rural area never came in for their prenatal care. They made a decision to close one of the hospitals and hire an army of nurse practitioners who went out into the community and did the prenatal care. And in less than a year, that move more than paid for itself, and actually gave them a surplus of dollars to do some really creative and innovative things for adult daycare and for seniors living in the community. So it allows more creativity, but not talking about this pressure about how to get people in and get people out, but what are the needs of the people we're serving.
And so overlaid on top of this, how do you factor in the liability issues and the legal, the lawsuits and the possibly frivolous lawsuits when something happens to someone in one of these care cases? What do you do about that whole expense?
Well, that's a whole other issue. Again, you're talking about things that are impacting the practice of medicine, and we're not talking about changing the practice of medicine. I think that, tort reform is another issue. We don't get tort reform because the majority of legislators in this country are attorneys, and and that profession has a vested interest in the status quo. We're just talking about providing people access to health care and allowing physicians to make the best decision based on clinical knowledge instead of based on what the reimbursement is going to be for the service I deliver.
Now, there are approximately, 45, 50 million people who are uninsured? Is that?
That's correct.
And is it accurate that the majority of this 45 or 50 million uninsured people are working people?
50% of them are working people. There's another 25% who are children.
And of the working people, they're not insured because they're not being covered by their employers. They're small businesses. They can't afford it. Various reasons like that.
Various reasons like that. Their employers may even offer them that as a benefit. But quite frankly, if you make $20,000 a year and your share of your family coverage is $4,000 or $5,000, you're liable to say thanks but no thanks. So even though it's offered as a benefit, you can't afford it.
Very interesting. Yeah, we're throwing out a couple of numbers there. You talked about the uninsured. Let's talk about medical bankruptcies. I was taking a look at a recent press release from the Physicians for National Health program, Dr. Fagan, and I read with much sadness that over 2 million Americans have to declare personal bankruptcy every year because of medical expenses. Is that correct? That's
correct. It's half of all personal bankruptcies are related to medical debt or serious medical illness. And these are the majority of these people who declare bankruptcy